Hello, my name is Mike Summers. Today I'm going to give you a lecture on on the importance of oxygenating your patient during a PAI or a pharmaceutically assisted intubation. Keeping oxygen in your patient is important because if their oxygen stats drop too low, you might not oxygenate the brain, might lead to brain damage. You have about 4 to 6 minutes, so that usually happens. Normally a PAI should not take 4 to 6 minutes, but sometimes you have what is called a prolonged laryngoscopy. That's where whenever you're trying to intubate your patient, you put the laryngoscope blade in, and then you try to find the vocal cord so you can pass the tube. Sometimes that takes a little while. Patients with big necks, or a lot of the times it's obese patients. Pretty much what today we're going to cover is why you would give them oxygen, how you would give them oxygen, the method of doing that, and I'm going to show you a video on the website, and then you're going to see how to do that, and then the first quarter of the class is going to go over. It's going to be lecture, and then I'm going to show you that video, and I'm going to show you a skill sheet, and we'll go over how everything's done in the lab later on. You'll do skills testing. You'll come back in here and take a test once you pass your skills testing, and then at your CE for the skill. So let's rock. So once again, you might ask, what is a PAI? It's a pharmaceutically assisted intubation. It's pretty much an intubation where you would give the patient drugs so that they pretty much don't know what's going on, so they don't start freaking out while you intubate them. It also takes away their ability to breathe, so you can just bag them at whatever rate you want. The reason you would pharmaceutically intubate somebody is because they're not breathing adequately on their own, and you need to put them under, intubate them, and then bag them or such at a rate to where they would be adequately oxygenated. It's intubation done after drugs are pushed to paralyze and sedate the patient with a gag reflex, so that you take away their gag reflex so you can intubate them. Drugs you could use, to paralyze a patient. You have succinylcholine, which is your short-term drug. Then you have becuronium and rocuronium and such. That you would use those after you successfully intubate the patient. Those last, usually up to an hour, maybe a little longer. Here we go. So once again, during the procedure, after the PAI medications are introduced into the body system, a patient can no longer breathe on their own. So you have to do it for them. You do that by intubating them and then connecting it to bag valve mask. Just take off the mask and then bag them with the bag itself. Just hook it directly to the tube. You visualize the vocal cords. While you're visualizing them, the patient is not getting oxygen into the bloodstream. Like I said before, that's a bad thing, especially after about 4 to 6 minutes, because then they start, to have brain damage and such. But with the oxygen, it's actually going through a device called a nasal cannula. It'll go through the nose, and then it'll get into the lungs, and then they're actually, it's not as effective as them breathing to give them oxygen, but studies show that it is effective in prolonged laryngoscopies. So it's an effective thing. Like I said earlier, prolonged laryngoscopy in patients that are difficult to intubate, such as obese patients with big necks. The big neck makes a lot of fat. You have your class 1, 2, 3s, and 4s when it comes to being able to visualize the vocal cords. The patients that are, you can't really see the vocal cords, they're very, very hard to find. You have some that are easy, some that are hard. The ones that are hard, those are the ones with the big necks, and then you'd have to do the prolonged laryngoscopy to try to find the vocal cords so you can successfully intubate the patient, so you can bag them and ventilate them adequately to give them their oxygen that they need to survive. So pretty much what it is in patients that are difficult to intubate, such as obese patients with big necks, you might have to have a prolonged laryngoscopy or extended period of time when you're trying to intubate the patient when they're not being ventilated. As you know, because you're at least at EMT basic if you're watching this because it's for CE, You have to ventilate to breathe, because what keeps you alive is, you know, the blood going round and round and air going in and out. So what do we do about it? Oxygenation via nasal cannula. Placing the nasal cannula on a patient while they're being intubated will increase the amount of oxygen in the bloodstream for a short amount of time, helping the patient outcome, giving you the extra time to pass the tube. The nasal cannula is a device that goes in the nose, around the ears, and then around the neck, and then you tighten it, you connect it to a oxygen cylinder, and then you turn on the oxygen at about 4 to 6 liters per minute, depending on whatever. Generally, you know, 5 or 6. A lot of people do 6. What it does is it'll introduce the air into the nose, go through the nasopharynx, go down the trachea into the lungs, of course, and then it'll just kind of sit there, and then it'll, you know, give you a little bit of oxygen because they're still circulating blood, because they're not dead, they're just not adequately oxygenating themselves. So you would the blood will circulate, go through the alveoli, and it'll pick up the oxygen that's sitting there. It's not, like I said, it's not as adequate as actual ventilations, but it does help the patient. It does help the paramedic be able to get his oxygen into the system, so he can, you know, have his prolonged laryngoscopy and try to find the vocal cords, so he can successfully intubate the patient. Like I said, place a nasal cannula onto an oxygen cylinder. This is going to say 3 liters per minute. You can go, you know, 4 or 6. You know, humidified oxygen is recommended for, you know, 4 to 6. But you place the 4 to 6, you know, for the short period of time is not going to hurt your patient. Might dry their nose out, you know, a little bit, but I mean, that's not very significant, because the 6 liters per minute will get a little bit more air in there, might buy you a little bit more time. But I mean, you place the nasal cannula onto the patient, aiming the 2 little prongs on the nasal cannula into the patient's nose. And like I said earlier, it goes in the nose, and then it goes around the ears and around the neck, and there it is. So the video I'm about to show you is an instructional video on YouTube. It's a lot of teachers that I know use YouTube. A lot of good instructional videos on it. There's in the video, it shows you how to how to operate the oxygen cylinder, and then it shows you how to do a non-breather mask, which we're not going to do for the purpose of this exercise, because you'd be covering up the mouth, which you can't use. You can't cover up the mouth while you're trying to intubate somebody, because you have to use the mouth to put the tube in. Just ignore that part of the video. So here it is. Technical difficulties.
Ensure that you're following proper body substance isolation requirements. Ensure that you're following proper body substance isolation requirements. At the minimum, gloves and eye protection should be used. Assemble the regulator and oxygen bottle, making sure that you have the correct gasket or O-ring and that it is properly seated. Slide the regulator over the neck of the oxygen bottle, ensuring that the pin setup is on the proper side. Use the thumb wheel on the back of the regulator to tighten it down. Turn the oxygen bottle on and ensure that there is enough pressure in the tank to deliver the oxygen that is required. Take the oxygen tubing on the non-rebreather mask and attach it to the regulator. Pre-fill the reservoir bag on the non-rebreather mask by placing a finger over the oxygen inlet hole and then opening the regulator. Adjust the regulator to 15 liters per minute.
Like I said, you ignore this part of the video because we're not going to be using the non-rebreather.
In order to keep the mask in place, adjust the elastic straps and the nose bridge clamp if necessary. If the patient is unable to tolerate the non-rebreather mask, remove it. Choose a nasal cannula and attach it to the port on the regulator.
This is the device we'll be using, it's a nasal cannula.
Adjust the liter flow to 6 liters per minute or less. Apply the nasal cannula to the patient by inserting the prongs into the patient's nares, ensuring they are curved downward. Hook the cannula tubing over the patient's ears, and then adjust the slide to secure it under the chin. BSI for any airway skill should include gloves and eye protection at a minimum.
Okay, the next item we're going to go over is going to be your skill sheet. Okay, this is going to be your skill sheet. Your first step is your BSI. That's going to be your gloves. If you want to, you can wear a mask. A lot of people wear that. Glasses is highly recommended. That way, if the patient throws up while you're trying to intubate them, that's a common thing that commonly happens. It doesn't get in your eyes and doesn't you don't contract any diseases they might have. After you, the instructor notifies the student that the patient cannot be intubated in the 30-second time limit given to work on an unventilated patient. In other words, the patient cannot be without oxygen for 30 seconds. That's a whole nother, that's comes down to the intubation skill where when you're trying to intubate your patient and give an advanced airway, they cannot be without oxygen for 30 seconds. That includes ventilations. The first thing you're going to do is you're going to take your nasal cannula and then you're going to place the nasal cannula on the patient in the appropriate manner. Before you do that, you're going to connect the nasal cannula to the oxygen at 4 to 6 liters per minute. You never want to place a device on a patient without the oxygen going through. You're going to verbalize the importance of the oxygen during the prolonged laryngoscopy. That way you know when you're performing a skill, you need to know what you're talking about. Otherwise, performing the skill is completely pointless. It's like buying a car and not knowing how to drive it, essentially. Your failing criteria is going to be you fail to execute BSI precautions. You have to do BSI. That's very important. You have to grab the nasal cannula. One of the failing criteria is do not grab the wrong delivery device. If you grab a BVM or a non-rebreather, if you grab the BVM, you're halfway right, but you should already have that for your ventilatory skill. You have to grab a nasal cannula. A student placed the device in an inappropriate manner on the patient. That'd be if you placed it pretty much anyway. You got to place the prongs up, down the nose, around the ears, and then around the neck. And then you got to tighten it. And if you don't put on the O2, then that's also a failing criteria because you're not supposed to put a device on a patient without oxygen.